Well, welcome, welcome. Why would you check a kid? Because if their structure's off, their function's off. If your spine in better alignment and function helps the body function better, why wouldn't we get a child checked just as much as an adult? We just might not think about it because they don't hurt, right? Let's talk a little bit about that. Hopefully I can address a couple things. Is it safe? Because I would say almost 50% of the reasons that people may not see a chiropractor is they think that it's not safe or they could just be hurt more. The really sad truth is there's probably a lot of things that we would assume are very generally safe and effective that actually have more risks than my adjustment by far. But to not get a baby checked because it seems risky is kind of not really true. What we can do, how do we get a child to start seeing chiropractor earlier? What are the ages we'd want to do that? Chiropractic adjustments, can they work for a child just as much as an adult? We're going to go over some things that we usually see children with in some of the research, but we see a lot of children in this office that are not benefiting because they have a headache, although that can happen. Colic, bedwetting, sleep issues, those are some of the biggest issues why we see children. And they've kind of just not gotten relief in other ways. And that's why we end up seeing them. Like I said, the big picture is that your nervous system is your master controller. Your nervous system is the very first system to develop. Your brain, that little bit of gray matter, it happens almost at the moment of conception. You have gray matter. From that brain, you start to develop a notochord, which is just a primitive spinal cord. After that starts to form, buds form off of that notochord. Those are your organs. So people are like, well, what's the most important system? Your heart doesn't even develop until you have a nervous system. Well, I got to breathe. Well, you do. But that doesn't happen until your nervous system can tell it what to do. So if we look at how we were created and use that as kind of a guide of what's the most important thing, the nervous system is. Your body develops first what's important and protects most what's important. So that means that we have to take care of that for the rest of our lives in some way, in a better way. But why wouldn't we try to teach kids and help kids to protect that system sooner? Just because there's no vaccine for your nervous system, there's no supplement for your nervous system, doesn't mean that it's not important. So this is why we talk about these things. Chiropractic, what it's going to do for children is ultimately improving spinal function and removing that stress on the nervous system. Your spine's function isn't just about pain, it's about the overall quality of your life. If your brain and your spinal cord are not receiving all the information that's going on in your body as efficiently as they can, those subluxations, just think of them as weak Wi-Fi signals. If you tried to watch a YouTube video right now in my basement, you'd be like, just buffer, it would slow down, you'd miss words. That's what a subluxation is in your body. It's a weak Wi-Fi. When we adjust the system, we ramp up that Wi-Fi signal, okay? And so why wouldn't we want the children's Wi-Fi signal to be as ramped up as possible? So this is why we make those adjustments, especially while the brain and the nervous system is developing, right? Safety. In a study that was done with nearly 22,000 parents found that, and this was treatment of young children. In that research, the parents reported a 99.7 positive experience. The only real side effect, or we call it complication, was some of the kids were a little bit more cranky after their adjustment. But the safety is very, very sound. And this is probably one of the number one things people think of. But again, like I said, if you don't really know, you fear what you don't know. Earlier the better. People will say, hey, well, how early do you see a baby? I've seen them 1 day old. I have. Have I had to adjust them? Not much, but realize that subluxations for babies start in the womb. I just saw a patient and she had a fall while she was pregnant. But what was interesting, because I didn't put this together, somehow it didn't come up, I actually wasn't seeing her first. I saw the baby and was going through some developmental things. And after one adjustment, I can tell you, the baby wasn't ever rolling to the side. After one adjustment, started rolling to the left side. Would never put his feet in his mouth. After about a couple adjustments, feet were going in the mouth. And so the mom was like, I better go get adjusted. So then we found out that she had fallen, and you wonder, what was the baby's misalignment, some of that challenge, And of course, mom was thinking more for herself, but there's a lot of things that can happen. So in utero, either babies can be, certain women will have a lot less room for baby than other women. You could have other spinal issues initially when you're bearing that child, and you don't really know you have spinal issues till you have the child. But then it shows up that, oh my gosh, maybe I did have a problem. So there is misalignments of mom that could kind of affect baby being able to move and turn in the womb. Baby's position in that womb could cause misalignments to some degree. The birth process itself is very traumatic for all involved, and that could definitely start a subluxation. So to think, why would I check a baby on day one? Well, because I had 9 months of not checking that baby to be true, and the birth process itself. We want to start that process out simple. Baby's adjustments are pretty much light pressure in my finger typically. There'd be very little ever force. It's usually pressure. I have an instrument that has a slight click. It has a very low amplitude of movement, but it's like a fast little impulse. That's how the brain gets stimulated. So typically most babies, I'm adjusting like all their bones. If you guys will hear me, you have 10 subluxations or 15 subluxations. Kids usually, the most they'll have is like 4, maybe 2, okay? And it's very simple. They correct very quickly. Typically what we'll see is that these subluxations usually it kind of will affect babies' feeding. That's usually brings them in. They just might be more colicky or cranky. They don't, startle as well. Colicky babies do real well. There's a number of studies that have shown improvements. There's one in Denmark that they tested methicone and some of the anti-gas medications versus adjustments. Adjustments outperform that hands down. When we adjust the nervous system, and you guys can see in here, but that chart right there, that's all the organs. When I adjust the body, I'm not just adjusting the spine, I'm actually affecting those nerves, and some of them go to the digestive system. A lot of times babies have a lot of effect in that. So if we can kind of tune down the digestive system, get it to calm down, the baby calms down. So the adjustments are there to help calm the nervous system and balance it out. That's why we do those. Bedwetting is just another one of those communication issues, right? I mean, if the brain isn't being able to keep the control of the bladder throughout the night, then there's some interruption in that process. Because when the body's asleep, there's a process in which subconsciously that brain is keeping the bladder from emptying until it was bad enough it would wake you up. But when you don't wake, there's a miscommunication. And very simply, usually it's those little sacral segments again. Those are the same ones that could cause that bedwetting for a lot of kiddos. So it's not the child's fault. There's usually not a problem with that. It's typically that there is some misalignment there. And those are really common areas. If you guys probably both have ever seen the kids start to try to walk, they're falling on that butt constantly. And so when I always check babies, usually at the very, very minimum, I tell parents usually is like every 3 months, because there's usually big developmental changes every 3 months. But definitely when it's getting close at walking, there's a lot of times we should probably be checking them. But the body develops so quick in that first year, I like to make sure we get that good first year under our belt. I've checked fairly frequently. In the clinical trial, there was, I'm trying to think how they did this. They were receiving adjustments in this clinical trial. They would receive adjustments, kids that were having bladder control issues. And I can't remember how often they were getting adjusted, but the adjustments were happening. And what they found was 50% or more had a reduction in the wet nights, 50% or more in that study. 1 in 4 children had like over 50% improvement. Like we talked about, I've been talking a lot about infants, but kids grow, as they're growing, the simplest way to describe this is as the twig is bent, so grows the tree. There are so many kids that I've seen lately that if I'm seeing them and we've caught it kind of soon enough, or we're starting to see some issues, that it probably is something that if gone unchecked would develop a scoliosis, but we are able to make some adjustments to it and have some simple exercises that you're doing that minimizes the severity at which it does. We can't say we prevent scoliosis or we reduce it down. When it's bad, it's bad. But the adjustments, if nothing else, are kind of helping some of those kids to just function better, because I have plenty of kids that are in high school now. It's a little too late for us to try to correct a lot of those things, but them getting adjusted, they're helping their sports. They're still athletic people. And when they're getting adjusted, they move better. They're like their baseball players, some of them, and they're like, man, I've never been able to swing that fully because they hadn't been adjusted. So a lot of kids also that I see, they might consider a scoliosis. It's actually just like a shift of their spine. Those kids, when we adjust them, they do real well because their spine really isn't as twisted. It's just shifted. But little slips and falls, injuries, falling off the bike, sitting in school in different ways, if that's a little bit crooked and then the child happens to grow really fast, then the body can't keep up trying to keep it as straight. And that's where these curves happen, because your brain and your eyes are always trying to stay level with the ground. So if your spine starts to grow a little crooked, well, your body isn't just going to keep going that way. It's going to try to get your head back, which that force then causes the spine to go here. And then if it's too far, then the body comes back. That's why sometimes we call it the double S curve. All right. But it's not that every child who gets adjusted never has a scoliosis. I do have kids that have had that, but it's one factor that's simple to be doing. So getting checkups regularly, when they're carrying book bags and they're doing a lot of postural stuff. Now that kids are like constantly on technology from day one, I see so many kids that are way hypertense in their shoulders. They have a lot more tighter pecs. Their heads are more forward. I mean, almost every x-ray I've ever taken of a teenager now, their head is forward of their shoulders significantly. I've had some really significant, like 40 millimeters in like 17-year-old. That's an inch and a half forward. And, it's tough being a kid, and sometimes confidence is even affected when your posture gets worse. So, and then, it goes in bitter cycle. So getting adjusted sometimes helps to reboot those kids just in general, So this is why we're taking care of those kids in these ways. With any of our assessments, always going to be just like ever. We're going to assess to see and do a screening to see if we think there's a chance that there's subluxations. So the kid doesn't have to have any issues at all. We're going to check and we'll be able to feel them or we'll be able to see them. Very simple. simply. There might be some symptoms going on that need that, but we'll screen first always. The next step is going to be after screening, we're going to develop some sort of a plan just like we do with anybody else. Typically, they don't need as much work. Usually they're going to respond a little faster. Their body hasn't had a pattern of these misalignments for 20, 30, 40 years, right? And so that's usually a simple process. Whole families get adjusted here without it being some sort of huge financial barrier. We usually make it as affordable as we can. So anybody has multiple family members in our office, they're always going to get a little more of a discount if the insurance wasn't covering them or something like that. What are some of the things to do to kind of help support the spine, health of your spine for kids? Your kids, your grandkids, things like that nature. Encouraging movement is just so huge. Your nervous system learns by movement. There are parts of your brain that will learn without movement, but screen time, we talk about screen time or games or things like that on a computer. Now there's a whole other workshop we do, it's called digital dementia. And when you're in front of a screen with especially like a lot of action, a lot of activity, there are parts of the visual parts of your brain are overstimulated and the movement parts are understimulated. And the brain doesn't really like that imbalance. It expects that if there's a lot of visual stimulus, that means you're moving, you're like involved in something. And when you're not, the brain starts to really have a challenge with that. And this is probably where some people like suggest that ADHD and other challenges in brain development happen because of a huge imbalance in control, in stimulation of the brain. Way too much here, very little up top in the frontal lobes and the movement lobes. The outside is the best playground. And it was developed, by however you believe your creator or however it came about, but it was built for us humans. And the colors, the sounds, the sights, the smells, all were built to stimulate our bodies. We do another workshop, it's called ecotherapy or ecotherapy. It's all about how nature can be very healing just being outside. But, you're trying to get a kid to develop, keep them outside as long as you can. And back in the day, we'd say, we were locked out of our house till this time, or we would be sad we wouldn't come home till whenever. That's because that's where all the fun was. Now we can put it on a screen, and there's definitely challenges there. So limiting the screen time, encouraging movement are huge. Backpacks can definitely be a challenge. I guess kids don't use lockers now. My kids at COVID, so my kids were in school during COVID, they didn't let them go to the locker. And now somehow they never went back. I don't know why. They're afraid to just go, not do the combination. They won't even go use it. So most kids keep everything in their backpacks. It's a challenge. So as a parent, if there's ways to limit that or try to move it, just be careful. It should only be about 10 or 15% of the body weight. So, I got some small 6th graders that come in here. And 10% of body weight is probably 5 pounds. There's no way they're only carrying 5 pounds, right? So just being aware of those things. Sleep is huge. My son's in athletics. And he knows now. He's like, if I don't sleep, he's just not at his game. And he's like, so the adjustments can actually help with sleep. So you kind of see some of the research we were talking about, but melatonin's released when you get adjusted. So as some children need to regulate, it's good to get adjusted, but the prioritizing sleep is important. Just watch for bad postural patterns. If there's a high shoulder all the time, if you're looking at pictures of the kiddo and you see, some high shoulders or high hips twisted or head tilted, time to get them checked out. Those could be little signs of that twig being bent. And you probably wouldn't even think anything of it, but just starting to have a critical eye of looking at those patterns for kids and for the forward head position. Those are all very important. The biggest thing is just kind of, hey, there's people, you guys here, you don't have little children. You might know little children. You might have, grandchildren. You may not. But there are probably people in your lives that are concerned about their child and things that are going on. Younger and younger kids are having more and more problems. It's crazy. So my point is this, is if a kid has a headache, it could easily be because of their bad posture, the way their head's positioned, some tension in their neck. But as soon as we start opening it up to the medical field, if it's a misaligned problem, there's no medication that's going to realign the spine. There's not really even a physical therapy fully that's going to realign the spine. And unfortunately, when there's challenges, the body is going to, and medically they can't seem something easy, they're going to start doing more and more tests. And the more tests you do, the more chance you might have of seeing something or finding something that may be concerning, but we're not totally sure. And the more we go down that pathway, it could lead to more and more invasive things. And so there's probably things that happen to people medically that are definitely more aggressive or more concerning or more risky than an adjustment, just because they had this one issue that went down the pathway. I'm not saying not to get checked. I'm all for the tests. But if there's easier, safer, more effective ways to take care of our bodies, let's start there rather than end there. I guess is the point of my talk. Is there's a lot of kids do a lot of things, and the adjustments are so powerful and so simple and so safe that to get a child adjusted now, but rather wait till oh my gosh, we got no other choice. I guess we'll try that chiropractic stuff. It just doesn't make sense with what's out there. So tell people, just share with people what you learned. Let them know that there's never anything going to be done that you don't want done, but it's good to get checked now. And the body will tell you the truth, right? You gotta go share this info now. All right, I'll let you guys go on here.